It really is not. So when all of these vaccines are introduced and when these schedules are devised, the studies that are done specifically look at administering the vaccine along with whatever other vaccines are available and approved for patients of those ages. And your immune system is perfectly capable of mounting an immune response to several things at the same time, just as we do in life. So both in terms of safety and effectiveness, there's no diminished effectiveness or increased risk in terms of getting multiple vaccines at the same time. And so once again, it's appropriate if a patient's in the office and happens to need their Prevnar and their Tdap and their flu shot, which wouldn't be uncommon at this time of year. It's perfectly fine for those patients to get all of those vaccines at the same time, and we would expect a perfectly robust immune response and protection from disease. And once again, that gives you the opportunity to not miss the chance to immunize someone, because if the idea was that they were going to come back in a month and get another one and a month after that and get another one, first of all, there's no reason for them to do that, but even if they did, they may not come back for those subsequent visits. The only one of these vaccines that we've mentioned is the one that you just mentioned last. The Zoster vaccine is a live virus vaccine and should not be given to patients who are immunosuppressed. But the Tdap, the Prevnar, the pneumococcal vaccine, the influenza vaccine, the injectable influenza vaccine are all killed, and there's not a safety issue in terms of giving those to people with other medical conditions. And in fact, it's particularly important for people with other underlying medical conditions to get those vaccines, but also not an issue in terms of patients who may be immune suppressed because they're killed. Now there may be an issue in terms of their effectiveness. If your immune system isn't up to snuff, then you may not mount the appropriate immune response to those vaccines, but the killed vaccines, but it would not be a safety issue. I think that really is the point, is to remind people that, part of the vaccines have kind of been a victim of their own success, in the sense that diseases that used to be common diseases are largely not seen anymore. There are very, very rare cases of tetanus because people get tetanus shots. And so I think as bad as they are, for example, to have had this pertussis outbreak and these measles outbreaks, I think that reminds people that the diseases have not been eliminated, and the reason that the diseases are rare is because people get vaccinated, and that it's important for them to get the vaccine. And oftentimes to take the opportunity to, again, dispel misconceptions that people have about the vaccines, and most people will see the logic in that and realize that it's appropriate to be vaccinated. There are studies that look at vaccine uptake, and that does improve over time, so people are in fact getting vaccinated more now. The rates are still not as high as we would like, but more and more people are being vaccinated.